Can I get you all to close your eyes? If it's a bit creepy in here and you want to keep them a bit open, that's fine. I want you to bring to mind the single most important thing or person in your life. Okay? I know that a couple of you here will be thinking of the mighty Tranmere Rovers right now. But for the vast majority of you, you are thinking about a person. You are probably thinking about a member of your family. Maybe a parent, a spouse, or a child. You might be thinking about a close friend as well. We're more disparate now, but you are thinking about the close relationships in your life. Okay, you can open your eyes. If you weren't thinking about close relationships, that's fine. But most of us do, because actually our relationships and our families are the most important things in our lives. And that's not just me saying that because I want to talk about it. It's because actually it's evidence-based and it's verifiable. The single biggest factor in our happiness as humans is the quality of our close relationships. That actually we've been measuring well-being in the UK since 2011. And alongside health, one of the biggest factors in self-reported well-being is whether we're married or in a civil partnership. Our families fundamentally matter. And so when we're thinking about a storytelling event like this, I want to talk about families because they are absolutely at the heart of all of our stories. And they really matter in healthcare, and they're not talked about enough. The difficult side of this is there are 108 billion people that have existed, and so have a story to tell about their families, and no two are the same. And those stories are some of them are really, really hard to tell. And in a room like this, half of you will have really, really tough stories. And so when we talk about family, we're talking about something personal and we're talking about something sensitive. But the situation we're in now in the UK and the impact it is having on our health, on our housing, that it's having on all different areas of life is too important not to talk about. So I'm just going to pick two bits of research to talk about family and health, and I'm going to talk a bit why we're in an emergency now. So the first thing I want to talk about is our physical health and how family matters, okay? So there's research out of Brigham Young University in the States. They went around thousands of people in late middle age, and they checked up on their diet, their exercise, their pre-existing health conditions, all these sorts of things, and then left them for 7 years. And 7 years later, they just came back and went to see who's still standing. And then they looked at what are the factors, what are the best indicators to see who's still standing, and they gave us their top 10. Have a quick think. What do you think is in the top 10? In 10th place, nice to have, not that important, clean air. In 9th place, and I found this one quite surprising, think of how much we spend on this in healthcare. In 9th place was whether you had your hypertension treated. In 8th place and 7th place, overweight and exercise, so that's important, but still not top of the table. Above that, you had cardiac rehab, so if you'd had a cardiac event and you had rehab, that's a good thing. I was pleased to see flu vaccination above that, getting into the top half now. Flu vaccination, it matters. And then the next two public health classics, whether you've quit drinking and you've quit smoking. Those actually do matter, but they're not the top ones. The top two were our social integration and our close relationships. Those two things are the best indicators of a long life. By social integration, I mean those touch points. It's whether you talk to your postman and milkman, the people on your street, you say hi. By close relationships, I mean those really tight relationships that you can rely on in an emergency, whether that be, a small debt or an existential crisis. It's fundamentally important to our length of life and our physical health, more so than smoking or exercise or hypertension by a long way. So I want to think just briefly about mental health as well now. And the relationship between mental health and family is probably slightly more intuitive, and there's a lot of good stuff out there. And so I'm going to challenge us to go a bit further and look at some of the more challenging data. And Richard said to be a bit challenging, so I hope you give me some grace with this. But I could talk about all the different trials that have done. The Mental Health Foundation does brilliant work, but actually the ONS released some data only 2 or 3 weeks ago now, looking for the first time at mental health and family structure. And this is very countercultural. We don't like talking about this now, but looking at how structure, when we control for income and other factors, how does the very structure of our families affect our mental health? And they found that in primary school children, if you have married parents, you have about a 6% chance of a mental disorder. If you have cohabiting parents, it doubles to about 12%. And among separated parents, it trebles to 18%. Now, like I say, this is tough. Half of us in this room have first-hand experience of what we are talking about, and there are other factors involved here too. But the reason I want to talk about this today is because the situation now in the UK is at a unique point in history and a unique point in the world for being desperate. We are now, despite being one of the biggest GDPs in the world, we are also a world leader in family breakdown. And that has happened in just one generation. That security at home that children used to have, simply they do not have anymore. And that is affecting their mental and physical health in a major way. And whilst talking about marriage can be quite uncomfortable and feels a bit Victorian and austere, and even if we don't completely buy into the reasons behind that, maybe actually it's the factors of people that get married that brings it. We're not quite sure about that. The reality is that marriage is almost dead in this country. People aren't willing to commit, whether or not commitment is the factor or marriage is the factor. We've been married for thousands of years in this country, and we've been measuring it for 400 years. And at this point, we're not just in a low point, we are in the historically low point. And not just in the historically low point, we now have a marriage rate of half the lowest point in human history in the UK, which, to put in context, means that in the middle of the First and Second World Wars, more men were getting married than are today. And the impact that has, that we are not creating these people willing to commit to each other in families, the impact that has on our children's mental health, the impact that has on our physical mental health, is going completely uncommented in healthcare. And so I just want to leave you with a question and a challenge. We know the evidence says family is important. We know that we're in a state of absolute crisis in this country. Are we willing first to talk about it? And if we're willing to talk about it, what are we willing to do in healthcare to address it?